Thank you so much, ma'am, for those elaborate introduction, and it feels really nice when they come from the mouth of someone as good as you. So thank you so much, ma'am. Now, I'm sure all of you have seen Star Wars, Transformers, alien movies in the Hollywood and stuff like that. Similarly, go back 2000 years ago. 2000 years ago, will somebody in their minds have imagined that one fine day there will be a mic, there will be a laptop, there will be a projector, and this is the mode that people will be studying and learning with? Will people would have thought of that? No. Similarly, when we speak of cancer prevention now, we are in a very much, kind of a budding stage. But I'll give you a scenario. This scenario, may come true 100 years from now. A lady, let's name her Mrs. XYZ. So Mrs. XYZ walks into a prevention clinic, and she has come here for her routine annual checkup. She does some minor blood tests. The doctor calls her and tells her, look, Mrs. XYZ, as far as what I see, there are some abnormal cancer cells somewhere in your body. So let's do some more tests. It won't be a dangerous situation because, we have found it very early. Mrs. XYZ is okay, convinced. She does some more blood tests. And then the doctor tells her, ma'am, you have a cancer in your renal cell carcinoma, okay? The lady is diagnosed with a renal cell carcinoma. But unlike the medicine system of today, which says that, okay, you have a renal cell carcinoma, this is the drug. The doctor now tells her that, ma'am, we are going to target the molecular hub. We are going to target those things which are actually causing this abnormality to happen. The lady understands that. The new sort of a treatment begins. The lady goes home. She gets a call from the nursing department. The nurse gives her a call, asks her how she is feeling today, just to know whether there is some abnormality or not. The smartphone that the lady has is equipped with a chip. You have all seen glucometer, right? All of you have seen glucometer? The way there is a chip in it, you put one drop of blood, it tells you this is your GRBS. Same way, the nurse instructs the patient on phone, the patient puts a chip in the phone, puts a drop of blood, and the drug levels in the body are measured. The nurse again gives a call and she says, okay, I'm connected with you through my electronic medical record systems, and I can see what you are feeling right now. If you're feeling fatigued, I'll give you the interventions. If you're having nausea and vomiting, I give you the interventions, and so on. So, do you think all this is really futuristic? Sounds like Star Wars? But that is, my dear friends, the ultimate scope of cancer prevention. You see how this Mrs. XYZ was detected so early? You see how this Mrs. XYZ was treated so early? And the follow-up that was done was so smart and convenient at her doorstep. That is what is the ultimate scope of cancer prevention. But right now, you and me, we are living in the scenario where, once upon a time when somebody would have told, Earth is round. What did people tell him? You are mad, fellow. I'm not going to listen to you. You must be mad, Earth is flat. But now we know that no, Earth is not flat. Same way, one fine day we'll all discover that the ultimate scope cancer prevention has is not limited to what we know right now. But for the sake of our presentation today, I'm just going to share with you all only those things which have been standardized, proven to protect against cancer. So with this small story and narrative, let me begin my presentation. Now, I looked at these scores, and the scores are like, really bad. It says that the cancer mortality would be up to 1.2 million in the year 2020. And this data is not a worldwide data. This data is only from South Asia. That is Bhutan, Pakistan, Bangladesh, India. Now, are we in South Asia prepared for this sort of cancer patients coming to us? Do we have that many oncologists? Do we have that many oncology nurses? I don't think we are ready to handle this situation. But there's one good news. And what does that good news say? It says that 1/3 of all the cancers are preventable. That kind of puts us into a relaxed situation that, okay, although we cannot do so much to cure it, we can still do so much to prevent it. Now, here lies the next question. What can we do to prevent cancer? It's like, somebody who is scared of a disease comes and asks you, okay, what do I do to prevent cancer? What do you answer the person? The answer comes in your following slides. These recommendations are given by WHO and UICC collaboratively, and the first recommendation, although girls are very fond of it, they love crash dieting. So it's not about crash dieting, but it says be as lean as possible without becoming underweight. That means your BMI has to be a balanced one. You should not go into size -00 and not +00 also. The second recommendation says that we need to be physically active for at least 30 minutes every day. Now, we as nurses, we have this tendency. No, we work a lot. We get really tired. But actually, we are not our lifestyle is more or less sedentary, or we are in the moderate worker. So even we need to do this 30 minutes of exercise every day. Third recommendation. Avoid sugary drinks. I'm sure it's a very hard one for those who can't survive without Pepsi and Cola and Coke and so on. But you need to avoid sugary drinks entirely and limit consumption of energy-dense foods. Now, what do I mean when I say energy-dense foods? You feel hungry, you eat a big full apple. It gives you how many calories? Maybe 56 to 60. But you are hungry, you take a dairy milk and you eat it up. How many calories it gives you? More than 440, isn't it? So you need to avoid all those energy-dense foods. Fourth recommendation is we need to eat more of variety of vegetables, fruits, whole grains, pulses such as beans. So stick to the vegetarian part of the diet, it actually helps. That is what the fifth recommendation also says. It says limit consumption of red meats such as beef, pork, lamb, and avoid processed meats. Now, it is especially important here because once we consume processed meats, it's not only the meat itself, but also the number of preservatives that are used to, tin it and keep it safe for a long time. So those are also very dangerous to us. Sixth recommendation, avoid, if consumed at all, limit alcoholic drinks. I would again say stick to the first word, avoid alcoholic drinks. The seventh recommendation is limit consumption of salty foods and foods which are processed with salt. Now, all of you are aware that, too much of salt can lead you to the path of hypertension, isn't it? But too much of salt can also erode the mucosal lining of your stomach, thereby making us more prone for stomach cancer. Okay, so in order to prevent stomach cancer, we should also pay attention to this recommendation number 7. Certain do's and don'ts about the diet, we have already discussed these, and ma'am have given me only 10 minutes, so let me restrict myself. Recommendation 8 is don't use supplements to protect against cancer. Again, the reason for this, supplements are expensive, plus at the same time when you are taking a supplement, you have that false feeling, I'm doing what I can to prevent it. Let me not do rest of the things. So please know that your supplements don't actually help. Recommendation 9, it is best for the mothers to breastfeed the baby exclusively for the first 6 months. Reason, not only it's good for the baby by giving colostrum and the breast milk has so many benefits, but it is beneficial to the mother also. It is protecting the mother against breast cancer. And the last recommendation, once you go to the clinical areas, you will meet a lot of people who will say, "Mujhe to cancer ho gaya, mera to chemo chal gaya, surgery ho gaya. Now what do I do? Why should I follow all your recommendations now?" But even those who have had cancer, who are cancer survivors, even they need to follow all these 10 recommendations. So it's easy to remember, we have 10 fingers and there are 10 recommendations. The 2 most important ones so far, be lean, don't put on a lot of, excessive weight, and you need to work out every day for 30 minutes. Apart from that, a vegetarian diet will do you a lot of wonders. This one more thing, it's like, ऋतिक रोशन को एक छोटा सा extra thumb है ना, वैसे इन 10 recommendation के साथ एक छोटा सा extra thumb है. What is that? It says, do not smoke or chew tobacco. You will be surprised, this was a survey done by UICC in South of Asia. That is again your India, Pakistan, Bangladesh, Bhutan, Sri Lanka. And the survey says that 60% of the men population in these areas get cancer only because of tobacco exposure. So isn't that data, it makes me hate all the cigarette companies, and it makes me hate all those of us who are not educating the public on the need to stop smoking and the need to stop chewing tobacco. Okay? So I'm sure all of you, once you go out from here, you need to pass on this message to all these smokers and tobacco chewers that you meet. Now, this is, something very important. As I said in the beginning, 1/3 of the cancers are preventable. We can follow 10 recommendations and we can protect ourselves from cancer. But what is the problem? Why is it not getting done? So there are actually two problems, Most of us have this attitude. What does it say? I hear when someone talks about prevention, but I don't trust it. So I won't follow it. Because as a nurse, I have seen thin people dying of cancer. I have seen fat people dying of cancer. I've seen smokers dying, I've seen smokers living, so I don't trust the recommendations. So that is a, mistrust that even the healthcare workers of today have. So please believe all those recommendations are based on some strong research evidences. You need to trust it first. Only then you will be able to convince others of the need to follow it. Okay? So do not have this attitude that I'll hear, but once I'm out of this hall, once I'm out of this conference, I'm going to forget all about it. So, don't become a trap of this problem number 1. And what is the problem number 2 that we have? This is the problem. Cultural values, financial problems, lack of empowerment, lack of education. And what happens? People feel trapped. Now, if there is a lady who has a breast lump, by the time she decides, किसी को बताऊं या नहीं बताऊं, it is, 1 or 2 weeks. By the time she tells this to the female members in the family, it is around 3-4 weeks. By the time the family decides, okay, look, there's a serious problem, now we need to see the doctor, by that time it is almost 4 to 6 weeks. That is the precious time that the lady has already lost before she came and saw a doctor. Can we do something about it? Yes, we love our culture, but our culture does not say that if you have a breast lump, don't go to a doctor. Does it say that? Any religion, any book, something like that written? No, nothing like that is there. So we need to, try to understand people, try to understand their beliefs and help them to overcome all that is in the problem number 2 here. Financial problems. I won't say this is the case always because there are many hospitals which do cancer screening free of cost. Now, when I was a student, I never knew of places which are doing cancer screening free of cost. I have thought, okay, maybe it's expensive, that's why people don't go. But now I know there are a lot of places where cancer screening is done free of cost. One of them is our Dharamshila Hospital and Research Center and all the government setups. Do you think there is a long queue outside the hospital waiting to get screened? No. It's free of cost. So, finance is not always the trap. Most of the time it's the ignorance, it's the cultural barriers and the feeling that why should I get detected? Or if I get detected, oh my God, my life would be hell. So let's not get detected at all. So, these are some of the barriers which we need to understand and break the barriers in the brain of people so that they will come forward for cancer screening and early detection. Now, this was another study which says that it is actually the absence of empowerment. The females of the house, they want to get tested. But if the husband says, क्या करोगी जाके? If the mother-in-law says, तुम जाओगी तो काम कौन करेगा? Do you ever think that lady is going to step out of the house? No. So most of the time it's the absence of empowerment poverty and lack of education, which are impacting the health very, very adversely in today's scenario. And what does this cause? It causes late diagnosis, lack of compliance, lack of prevention, early detection, no treatment, no follow-up being given, resulting in poor survival rates. Cancer is not dangerous. This is what is dangerous. So what do we do now? We know the scope of cancer prevention. We know the 10-point of cancer prevention that we can do. In what way can we help in accelerating this process of cancer prevention? So let's see what we can do. At an individual level, the first and the most important thing we can do is we can be aware about it. The second thing, we know the 10 points now, we need to follow it. And the third thing, we need to go for early detection camps, and we need to be a role model in our own family so that at least our family members will come up for it. At an institutional level, we can make use of the important dates like World Cancer Day, Women's Day, all those days for educating people on the same. We can undertake an outreach program in our own hospitals, our own campuses, and then do something at the institutional level. And at a community level, we can participate in the activities of various national and international organizations, be it your WHO, UICC. They do so much of activities in India which people don't come forward to. And we can, in all these ways, at an individual, institutional and community level, help to curb this menace of cancer. Now again, when it comes to cancer, people have many, many myths. So the most important thing, as Madam Malik has rightly said in the session previously, education is the best vaccine. So I would say take that home, and you need to educate people on all the myths about cancer. That is what is the World Cancer Day theme for the year 2013. So now I hope and keep my finger crossed that all of you sitting here will participate in this in some way or the other at individual, institutional or organizational level, and make sure that this cancer prevention is actually accelerated. So everyone is with me? Yes? I didn't hear. That's better. Thank you.
Thank you.